Human sexuality is a complex and fascinating subject. It involves a delicate interplay of physical and emotional responses. At the heart of this interplay lies the phenomenon of sexual arousal, a physiological process that prepares the body for sexual activity. This essay delves into the science behind arousal, focusing on the mechanisms of erections in both males and females. Understanding these processes is not just about satisfying curiosity, it's about appreciating the complexity of human sexual health. By understanding how our bodies respond to sexual stimuli, we can better address issues, seek appropriate help when needed, and foster healthier attitudes towards sexuality as a whole. This exploration aims to provide clear and accessible explanations, making the science behind arousal understandable for a wide audience, whether you're seeking to expand your knowledge or simply curious about the mechanics of intimacy. This essay will guide you through the fascinating world of sexual physiology. Join us as we unravel the mysteries of erections, demystifying a fundamental aspect of human sexual response. The male erection is a remarkable example of the body's ability to respond to stimuli. It's a process that transforms the penis from a flaccid state to an erect one, enabling sexual intercourse. But how does this transformation occur? The journey begins with sensory stimulation. Touch, sight, sound, smell, or even thought can trigger the release of neurotransmitters in the brain. These chemical messengers initiate a cascade of events leading to an erection. One of the key players in this process is the corpora cavernosa, two sponge-like chambers running the length of the penis. These chambers are filled with smooth muscle tissue and blood vessels. When a man becomes aroused, the smooth muscles relax, allowing blood to flow into the corpora cavernosa. This influx of blood increases pressure within the penis, causing it to expand and become rigid. Simultaneously, the flow of blood out of the penis is restricted, trapping the blood within the corpora cavernosa and sustaining the erection. While often less discussed, females also experience erections, and the clitoris plays a central role in this process. Located at the top of the vulva, the clitoris is a small, sensitive organ, rich in nerve endings and erectile tissue. Similar to the male erection, the clitoral erection involves increased blood flow. When a woman is aroused, the erectile tissue within the clitoris, known as the clitoral crura, becomes engorged with blood. This engorgement causes the clitoris to swell and become more sensitive to stimulation. The clitoral glands, the visible part of the clitoris, also becomes erect and may protrude slightly. While the underlying mechanism of blood flow is similar in both sexes, there are some key differences. The clitoris, unlike the penis, is not involved in urination. Additionally, the clitoral erection is generally less visible than the male erection. Ejaculation, the expulsion of semen from the penis, is another key aspect of male sexual response. This process is a complex reflex action controlled by the central nervous system. When sexual stimulation reaches a critical level, the brain sends signals to the reproductive system, initiating a sequence of muscle contractions. The vas deferens, a tube connecting the testes to the urethra, contracts, propelling sperm from the epididymis, where sperm are stored, towards the urethra. As the sperm travel through the vas deferens, they mix with fluids from the prostate gland and seminal vesicles, forming semen. These fluids provide nutrients and lubrication for the sperm. The final stage of ejaculation involves rhythmic contractions of muscles surrounding the base of the penis. These contractions propel the semen out of the urethra in spurts. Section 5. Beyond the basics. Factors influencing erections. While we've outlined the basic mechanisms of erections, it's important to note that various factors can influence this process. Hormones, for example, play a crucial role. Testosterone, in particular, is essential for male sexual development and function, influencing libido and erectile capacity. Emotional and psychological factors also have a significant impact. Stress, anxiety, depression, and relationship problems can all interfere with sexual arousal and lead to erectile difficulties. Lifestyle choices can also affect erectile function. Smoking, excessive alcohol consumption, lack of exercise, and a poor diet can all contribute to vascular problems that impair blood flow to the penis. Section 6. When things go wrong. Understanding erectile dysfunction. Erectile dysfunction, or ED, is the inability to achieve or maintain an erection sufficient for sexual intercourse. It's a common condition, particularly among older men. While occasional ED is not uncommon, persistent difficulties can indicate an underlying health issue. Causes of ED can range from psychological factors such as stress and performance anxiety to physical factors such as diabetes, heart disease, and hormonal imbalances. Certain medications, such as antidepressants and blood pressure medications, can also contribute to ED. Fortunately, there are effective treatments available for ED. Medications such as sildenafil, commonly known as Viagra, work by enhancing the effects of nitric oxide, a molecule that relaxes smooth muscle in the penis, improving blood flow. Other treatment options include vacuum erection devices, penile injections, and in some cases surgery. Section 7. The female orgasm, a multifaceted experience. While we've focused primarily on erections, it's important to acknowledge the complexity of the female orgasm. While the clitoral erection is a key component of female sexual response, the experience of orgasm involves a complex interplay of physical and emotional factors. During orgasm, women experience rhythmic contractions of the pelvic floor muscles, the muscles that surround the vagina and anus. These contractions are accompanied by a surge of pleasurable sensations and a release of tension. Unlike men, women can experience multiple orgasms within a single sexual encounter. Section 8. The interplay of physical and emotional arousal. It's crucial to remember that sexual arousal is not solely a physical process. It's deeply intertwined with emotional and psychological factors. Feelings of love, desire, trust, and intimacy can significantly enhance sexual desire and arousal. Conversely, negative emotions such as stress, anxiety, and relationship problems can dampen sexual desire and make it difficult to become aroused. Communication plays a vital role in fostering emotional intimacy and enhancing sexual experiences. Open and honest communication with one's partner about desires, needs, and concerns can lead to more fulfilling and enjoyable sexual encounters. Section 9. Conclusion: appreciating the complexity of sexual response. As we've explored, the science behind arousal is a fascinating and complex field. From the intricate interplay of blood flow and neurotransmitters to the profound influence of emotional and psychological factors, understanding these processes is essential for appreciating the multifaceted nature of human sexuality. Whether you're seeking to enhance your own sexual experiences or simply to expand your knowledge, we hope this essay has provided valuable insights into the mechanics of intimacy. By demystifying the science behind arousal, we can foster healthier attitudes towards sexuality and address concerns with greater understanding and empathy. Remember, if you have concerns about your sexual health, don't hesitate to seek professional help. Please like, share, and subscribe for more insightful content.